Hello, I'm Christine Albert from Cedars-Sinai Medical Center, and I had the privilege today to present the results of the Vital Rhythm trial on behalf of my co-authors at Brigham and Women's Hospital and Massachusetts General Hospital. And the study was the first really large-scale primary prevention trial for atrial fibrillation. And as you all know, atrial fibrillation is a growing problem with an increase in incidence affecting maybe 33 million people worldwide. Currently, our methods for treating atrial fibrillation is we wait to see when it happens, and then once it happens, it actually has a lot of adverse consequences. So we wanted to look at primary prevention. The agents that we looked at were omega-3 fatty acids and vitamin D. And the rationale for both of those agents is that people with low blood levels of omega-3 fatty acids or vitamin D tend to have higher risks of atrial fibrillation. So suggesting that if you supplemented them, you might lower the risk of atrial fibrillation. There have also been multiple randomized trials that are secondary prevention on omega-3 fatty acids. And those, when you look at them in meta-analysis, did not show a benefit on recurrent atrial fibrillation. So we did this as part of the VITAL trial, which was a large-scale randomized trial of over 25,000 individuals, 20% Black, half and half, 50-50 women, who were randomized in a factorial design to Omacor, which is a EPA DHA 1.2 to 1 ratio, and or vitamin D3. And they were done in a factorial design, and we added atrial fibrillation to that trial prospectively at the initiation of the trial. We confirmed our atrial fibrillation endpoints by both, we asked the participants if they had a diagnosis of atrial fibrillation, but we also used CMS linkage to identify AF diagnoses. And then once we identified diagnoses, we went through the process of getting medical records and confirming all of the AF events. We ended up with 900 AF events, 3.6% of the population. And our findings on intention to treat were that neither omega-3 fatty acids or vitamin D lowered the risk of atrial fibrillation over 5.3 years of follow-up and treatment. The good news is that there wasn't an increase in risk either. So it appears that these supplements are both safe from the standpoint of atrial fibrillation. So the study does not support the use of either of these agents to try to prevent atrial fibrillation. However, it shows a model for how we might in the future do primary prevention trials for atrial fibrillation. And there are several lifestyle and other factors which might be promising agents to study. So I'm making a plug for future research for primary prevention of atrial fibrillation. Thanks for your attention.